So it's your first day working as a dental hygienist and your first patient asks you,
"So how long have you been working here?"
This is one of the frequent awkward situations for a new dental hygienist, and it's easy to get discouraged when you're a new grad, especially if you allow awkward patient interactions like that to shrink your confidence. So let's talk about ways to boost your confidence as a new dental hygienist. Hi, my name is Whitney and I'm a dental hygienist here to talk about how to be confident as a new dental hygienist. And really quick, if you want to learn even more about becoming a dental hygienist, I have a free RDH video checklist on how to become an RDH, whether you are in high school, college, or even if you're a new RDH grad. And no matter where you are on your RDH journey, I'll link below my free RDH video checklist for you to learn everything there is about this amazing dental hygiene career. First things first, just remember, you've completed your dental hygiene program. You've taken your board exams, you've passed them, and now you are a licensed dental hygienist. You're ready. So stop referring to yourself as the new girl or the new guy and use these following tips that we're about to go over to establish yourself as the upbeat, fearless hygienist that you are. Starting with number 1, plan ahead. Plan everything you need for each appointment ahead of time before you bring the patient back. Small things like having your tray ready or having all the XCP radiograph rings ready for your FMX. Having all of this ready to go before you bring the patient back is the start of a smooth, stress-free appointment. It's never a good look if your nervousness is showing as you struggle to find the correct way to stick the tabs to the sensor or situating the rings the wrong way, all while trying to still focus on small talk. So make sure you plan ahead. Number 2, collect everything. Collect everything you need before each appointment. I know we just talked about the physical things you need to do, like the x-rays and the trays, but something that's more of a mental thing you can do is check which patients need what. Who is due for bite wings? Who is due for an FMX? Who needs an updated perio chart? Who needs fluoride? Is fluoride once or twice a year, etc. Write little notes on your chart if you have a paper chart, or if you can, write in the little notes section on the digital chart. That's what I do. It's usually helpful for me. I still do it almost 10 years in. I still go through my whole day and I just type in the little name part, who needs what for the whole day. I do that every morning. And then I know ahead of time and I don't have to check before each patient. It's already on there. It makes it so much easier. Number 3, listen to your colleagues. If the other hygienists you are working with are good, experienced role models, ask for their advice and also listen to how they phrase certain things to patients. That's what I did. I was hearing how smoothly the conversations were flowing in the other rooms, how they explained the gum assessment and treatment, and I would listen to how the other hygienists would say it. It was always so confident and smooth. So I took certain words and expressions that I would hear and I used them in my patient conversations, and it would help my conversations go just as smoothly. I've absorbed so many tips by simply overhearing either my dentist or another hygienist in another room having positive conversations. Number 4, communicate with the patient. Use everything you know, whether it's something you overheard in the other room and you loved how they phrased it, or your own way of phrasing it, whatever the case. Communication is key. Sometimes we have a lot of information to pass along to the patient regarding the status of their gums, cavity situations, bone loss. It can sometimes be a lot. So it's okay to say the same thing a couple different ways or different times throughout the appointment to make sure they heard it and that they understand it. Even if you're on a tight schedule, you're stressed, you're trying to focus on your scaling technique, you can't forget to talk to your patient about their health. Silence is not the answer when you're nervous. Of course, all of us are different, but for me, I feel like once I talk it through, I'm confident again. Calmly explaining the procedure to the patient while you're doing it, telling them what you're doing can not only calm them down if they are anxious, but it can also boost your own confidence as well because you're feeling them calm down, so you're calming down as well. Good communication validates your level of experience to the patient. It validates it. So communicate, communicate, communicate. Number 5, if you're still not feeling confident, another great tip is to take an improv class. I know you're like, what? But improv classes are not only for aspiring comedians. In fact, most beginner improv courses are taken by the general public for personal reasons because improv classes teach you how to turn your stress and the butterflies in your stomach into fuel for your performance, which is useful for public speaking, social anxiety in general, and of course, your job, your career working in the dental office as a hygienist. If you could treat each appointment as a performance, focusing on the process, not the outcome, you'll be golden. I did this and I'm a new person now. I probably need to refresher, because I remember after that improv class, it makes you visualize that you're awesome. And then when you visualize that you're awesome, you'll be more capable of presenting yourself as awesome. So using these 5 tips, when the patient asks you on your first day, how long have you been working here? Sometimes one of the best, most honest and confident answers is,
I've only worked at this office for a short while, but I've been in the dental field for about 3 years now.
Maybe you were a dental assistant before dental hygiene school. Tell them how many years. Or maybe your only experience is from dental hygiene school, seeing patients in clinic. That's fine. Tell them how many years. It's not like you've never seen a patient before. Just remember, you have all the experience you need to succeed. You've passed all your exams. You've filled all your quotas. Now it's time to show off your skills by having confidence during each appointment. And speaking of your new skills, one more time I'd like to remind you all about my free RDH video checklist. If you are someone who is interested in the dental hygiene career, I made this video checklist especially for you because I get lots of questions in the comments and messages asking me how to become a dental hygienist, whether you are in high school, college, or even some of you have already graduated dental hygiene school and you're looking for more information post-graduation. Whatever the case, if you're interested in learning everything there is about the RDH career, be sure to click the link below. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.